Hey everybody, what's up? Alright, so right into this. Gonna take a quick look at some of the numbers. USA up to 125 infected confirmed now. 9 deaths, 8 of them in Washington County. Yeah, it's climbing up there pretty big. Yeah, it's only gonna increase exponentially now because well they say they're gonna test more and that's only going to show more. There's all kinds of news coming out. We're going to get into a bunch of stuff. Singapore's got 110 now. Switzerland took a big jump, and Switzerland is the home base of the World Health Organization, which the World Health Organization has confirmed there is a staff member who is infected. So yeah, the UK took a big jump. The UK is they got the National Guard on standby, or the army, I guess, and they've shut down all the schools, like closed everything. They've only got 51 cases and they're shutting down shop, which is kind of concerning, considering the US has, 125 and it's still business as usual. Yeah, I don't know. Canada is up to 33 cases now. Got 33, no deaths yet, but it's only a matter of time for everybody, unfortunately. And we got a bunch of new countries reporting, and yeah, a lot of these new countries, they don't have the greatest testing capacity for sure, right? There's a major supply shortage for these tests, and the stock market's open in Shanghai in a few minutes. We're gonna see what happens, how these markets perform. It's weird we're seeing gains, but the reason why we're seeing gains in the market is because everything's crashing so hard that some of these investors are buying up very cheap stocks because of these declines. So we're going to see jumps because people are jumping all over these really good stocks at a really good price, and hoping to gain on it, right? Hoping that it's gonna bounce back and they're gonna profit off this. But we'll see how that rolls out. We'll see how the virus impacts everything. So there was some rumors going around that in Nova Scotia there was somebody who tested positive and that they weren't being told, like they weren't reporting it, kind of thing. But they've come out and said no, that's not true. 7 people in Nova Scotia have been tested, but there's still no confirmed cases, and that's disturbing because even if there was 7 people tested, we know that these tests now are showing false negatives, right? People that are in fact infected with this the tests are coming back negative, and we'll get into that a little later. There's some more news on that actually as well. So rumors that at least one patient had tested positive in the Halifax clinic received wide circulation Tuesday, but a spokesperson said the claims were baseless. Are they? I don't know. Is it? I don't know. Nobody wants to admit that they got a case, right? Because it's gonna affect things a whole lot. But as of Tuesday, we got 30 cases reported in Canada. Well, there's actually 33. 20 in British Columbia, Ontario, and Quebec. But yeah, Canada now has, for us, Vancouver has 12 confirmed cases, and Toronto has 19 confirmed cases. Yeah, we're gonna have an outbreak in Toronto. There's 1 case in London, Ontario still. That's been one for a while. This person's been in quarantine, and 1 in Montreal. So yeah, but the United States is having a pretty big problem here on the West Coast. There's no denying that. Santa Clara's got 11, and the way that they're tracking this is through the genealogy of the virus itself. Through they'll map it, and it's kind of like a fingerprint, and they can tell where the virus kind of originated from. And there's supporting evidence now coming out of, well, not California yet, but there is a case in Washington that has no known links to the cases that are going around. So basically, what that means is that it's probably a local chain of transmission that happened in a transfer from somebody that took it here and passed it on to somebody else. So now we're seeing that, and of course we are going to see that. Unfortunately, our testing capabilities are extremely, delayed, I guess. We're suffering a pretty big lag in information. 3 days actually. On if everything was going right, if absolutely everything that could go right went right, we'd still be 3 days behind of what's actually happening. But we're probably about 2 weeks behind of what's actually happening and falling. And like every moment, we're just this virus is spreading faster, and we're just falling further behind. That's how it's working. It's not, it's like it's a double-edged sword here, right? So it's not just the virus moving in a one constant direction. We're also on our data gathering, we're falling further behind, right? Just with our testing capabilities. So unfortunately, that's the way it is. And we will get into that, our testing, because there's lots of news on that. So Washington, yeah, they're gonna have a, there some people calling this the Wuhan 2.0, and basically because Washington, Wuhan, I don't know, but they have a big problem here. They really do. There's an outbreak at the nursing home. There's staff members infected. There's nurses infected. These people here are way underprotected. Like, these little glasses ain't gonna do nothing for you. If this person is, like, maybe let's say a super spreader, we don't know. Like direct contact, right? These people most likely are gonna become infected. We can almost guarantee that. Even with their protocols, because they're gone into a nursing home, they should have been in full hazmat gear, like complete hazmat gear, but we don't have the resources to do that. This is all we got, and this is all we can do. So this is what we're seeing, right? If we had the capabilities of putting these people in the best of the best, they would be. But we can't just give the best of the best to our, to everybody. The best of the best has to be saved for the best of the best, right? For definitely like high profile scientists and people that are very knowledgeable, and it's most important to protect these people the most, because we start losing these top people, that's going to affect us greatly, right? We gotta think that this is going to infiltrate every crevice of our society, including our professional scientists and professional healthcare people, right? We have to really consider that, and it's already happening. We don't know the extent, but it is happening. There's nurses infected in multiple places. There's hospitals that are saying that they have outbreaks in the hospitals. We don't know if it's happening in the U.S. or Canada, or but there is other countries. Definitely Italy. Definitely, South Korea. South Korea is actually using a different method now. They're doing drive-through. You can show up, in your car, and they can take a test, which is pretty smart actually. Instead of going to the hospital, because we know that this will, in fact, go right through hospitals, and it's done it numerous times, and it doesn't take much, right? Just one infected person has to infect a healthcare worker or somebody in the waiting room. That might get admitted. We don't know, right? There's so many possibilities, and trust me, this thing is going to expose them. All our weaknesses for sure, because it's calling out everybody right now, and we're not ready. I'm sorry to say. The United States is definitely not. They're so far behind now. 31 cases now in the state. 4 patients were evacuated from the Princess Diamond cruise. Yeah, we got more news on a cruise ship. Another wow, this yeah, another cruise ship, and it's not good. It was from New Mexico, San Francisco to New Mexico or something. Yeah, but the person is in critical condition who was on this cruise ship, who most likely infected other people on the cruise ship, who, this is weeks ago that this happened. So, this person's, they won't be able to keep up, right? We can't keep up to testing the amount of people that need to be tested because the tests aren't there. They said, well, we're going to spend $9 billion. That's what U.S. officials are going to put into this right now. Um, but you can have all the money in the world, but if you don't have the supplies, it's not going to matter, right? It's not, right? That's what it comes down to is supplies, and we have a big shortage of them, big shortage, especially on the world stage. Unfortunately, so 3.4% confirmed cases have died. So that's a 3.4 fatality rate, but that's considering all of China's numbers as well that are so low for some reason. But I don't know. It just doesn't fit. It could be much higher. We don't. We just we're gonna take that with a grain of salt for sure. Um, because this thing has a major lag in its infectious time. So from the time that you actually get this into your system, from the time that you actually become infectious to the time you actually get the proper medical attention that you need, what's going, this is the problem. Major, major lag, right? Um, but we're seeing massive outbreaks all across the planet. The only place that doesn't have it is Antarctica right now, and just give it time. I'm sure if there's shipments going up there, it could very well be contaminated, right? Some of these remote villages or whatever. Yeah, because we do know that it does live on surfaces. We don't know how long this particular strain does, but other coronaviruses live up to 9 days, or can live up to 9 days, unless if given the right circumstances, which is kind of like they like they like cool and humid conditions to thrive the most. So, you know, um, on surfaces anyway, for sure. And the Olympic Committee said Tuesday Summer Games in Tokyo are still expected to happen, despite Japan having over 1,000 cases and 12 deaths and no sign of slowing in sight. Um, it doesn't, yeah, I guess. Well, you can't call it off too soon, right? So you just got to keep rolling with it. And it almost seems to be that way with the virus itself, not just Olympic events, but viral events. They just keep saying, oh well, it's all right. We'll just keep going. We'll just keep going, and then until we can't keep going. WHO emergency program, yeah, head of Mike Ryan says the need in Iran is more acute than for other countries. Well, there's something going on in Iran. We know that now. The Almost all the top officials are infected. One of the, like, I don't know who it is, but it just came out. We'll get into it a little after. We'll just kind of go through this in a row. But I'm not sure who it is, but he's a really high senior official, and he's been transferred to the hospital apparently for coronavirus. Yeah. So any U.S. citizen, this is new now, can be tested for coronavirus at the doctor's orders. So just because the doctor orders the test, you know, they don't have the testing capacity yet to do this. They're still very limited. Yes, okay, the doctor can order it, whereas before, the doctors couldn't order the test. It had to go through the CDC's approval to get it tested. And there's been many stories out already with people and doctors screaming at the fact, like, what the hell? You people are not allowing me to test people. Let's just actually watch a video on that right now. Here, check this out. And these guys are, this doctor, he's, yeah, I can't remember which hospital it is, but it's one of the biggest ones in the United States. And these people are almost laughing at him and mocking him when he's being like super serious. You can see how serious he's being, and they're kind of like, ha ha ha, coronavirus, ha 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 ha. And it's fucking scary, dude. Like, this guy's like, he runs the emergency department, and he's flipping out on national TV about why he can't test people. And then all of a sudden, the next day, the CDC changes their fucking shit. But they still don't have the test to test people.
To Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor. He serves on both Pfizer's and Illumina's boards. And Dr. Matt McCarthy, an infectious disease physician.
The doctor we're looking at is on the right.
The Race to Stop an Epidemic. Thank you both for joining us. Just to start off on a little bit different tangent, gentlemen. When did we discover penicillin? It was like in the 30s or so, wasn't it? I mean, what we've done in the past 90 years in the whole history of human existence, it's amazing where we are right now.
Discovered in 1927, became commercially available in 1944. We've had a long and successful history of diagnostics and therapeutics.
And we're better and better. Now we can sequence this thing instantaneously almost. We can do it in an automated way. Why shouldn't we be hopeful that we can come up with a therapeutic quickly?
Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
messed up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
On track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
So
and this is a testing issue.
What do you do with people in the emergency room if you can't test them?
But yeah, anyways, they just kind of keep going, and it's... But basically, that's the gist of it, right? He's very concerned because there's people who are showing symptoms, but the CDC refused to test them. But now, in fact, they have come back positive after they changed the criteria. So the CDC is under a shit ton of fire right now, right? And the reason being is it's not because they're purposely stupid and fucking this up. It's because they have to play stupid because they don't have the test to test people. The test got I don't know, there was a reagent or some kind of buffing agent in the test that allows the virus to, I guess, multiply or whatever, something like that. And this agent was contaminated. So it set the testing back, like, majorly, even on a global level, because they sent these kits to all not just the United States, they sent them to like 30 countries across the world. Right? Like, it was just a major blow to our ability to gather data on this. Already in a situation where it's terribly, terribly skewed. You know, even because, wow, it took so long, right? So Washington State risks seeing explosion in coronavirus cases without any dramatic action. And, you know, they're actually saying now that this here has been traveling for probably about 6 weeks undetected. And this thing only grows exponentially. It doesn't keep growing at a linear rate where it's just kind of steady, right? This here will, the more people it infects, the more people it's going to infect. I know that sounds kind of elementary, but it speaks volumes, because if you have, let's say, 100 people infected, well, those people could infect 1,000. And if you have 1,000 people that are currently infected walking around, they could infect 10,000. You know, that's how quick this jumps. It doesn't jump 1,000, 2,000, 3,000. No, it doesn't jump like that. The more people, and it really depends upon the environment which these infectious people are in, like workplaces, if they're busy, if they, we got nurse care practitioners and people who work at cancer units. A nurse that works at a cancer unit is now infected with this, and she's been going to work and not knowing, and she probably infected cancer patients. Like, how often? Like, that's terrible, right? Unfortunately, it is spreading way worse than, and they did a really good job at covering it up. Well, or at least tried to, right? Like, they stuck to the story, and that's all they could do. But unfortunately, we're seeing all this come out now, right? And they're going to blame it on the data. That's what they'll do. They'll say, well, the data was wrong, so, we couldn't accurately predict how bad it was. That's what they're going to say. You can guarantee it. That's why they're clamping on to these studies out of China, mostly, right? But now we're starting to see studies out of South Korea. People are focusing on South Korea's studies, and Italy's, but Iran is, they can't really keep up to the thing. But there's videos we're going to check out later about Iran, and you know what I mean. It's they've got issues there, they do, and of course they can't test because United States can't test. Nobody's going to really be able to test. There's certain, like, the tests are just not there, right? We just can't do it. What we can do is maybe, kind of, I don't know, maybe do like China did at one time and change the criteria for testing. If you have, like, let's say pneumonia and your blood pressure's low and you have a high fever and you got, all these symptoms that coincide with this, then maybe we could start classifying these people as at least suspected, right? Or presumptive, because the testing needs to be ramped up. And the thing is that even testing that criteria, we're only going to catch the most severe cases, which isn't, we know it's almost 3/4 or more of the cases are kind of mild, but they're still infectious, right? That's the problem. Yeah. So this here was the story about the CDC before, like they didn't take it seriously, and it's not that they're not taking it seriously. They just can't fucking test because they don't have tests. Like, you can't test people. It's not that they don't have them completely. Like, there's probably, a couple thousand tests kicking around the United States, right? But those are very coveted, right? And they're only testing them on people that are like, they just can't test everybody. Even if the doctor orders it, it's not to say that, they might take your blood sample or something, but it's not to say that you're going to get your test done right away. Because I really firmly believe that there's no capacity to test right now. And there's going to be, we'll go into other experts who feel the same way. So, friends who took a vacation to Italy have tested positive in Hillsborough County, and one of them insists she tried to warn authorities that she was sick before boarding her connecting flight from New York to Tampa International Airport. So she went to the authorities and said, hey, I'm sick. I probably shouldn't get on this plane and go to Tampa from New York. But they told her to get on the fucking plane anyway. So the two women who represent 2 of the 3 coronavirus patients in Florida, both in their 20s, they recently got back from a trip to Italy under a travel warning. So the woman says that she had masks with them and more masks. They're saying, well, masks don't help a whole lot. So once she landed in New York, she says that she had a fever. 29-year-old said she called CDC to let them know where she had been and how she was feeling, despite her flu-like symptoms and travel history. Right, she came back from Italy, and Italy has a big outbreak right now. So even despite her travel history and her flu-like symptoms, she says she was cleared, to fly from New York back to Tampa. And this is just recently. So no one sounded prepared. She said, no one at the CDC sounded like they were educated on what was going on. When I talked about an outbreak in Milan, Italy, I think they should know what part of the country that's in. So basically, but they probably have, she's probably not talking to doctors when she calls the CDC. It's probably an answering service, right? Or an outsourcing call center that, of course, can get escalated if need be. But, yeah. While she wants, to remain anonymous, she said she feels frustrated. It wasn't taken seriously sooner. Of course you would. And I feel like that too. I feel 100% the same way, right? You have to feel frustrated, but with seeing the lack of competence or capacity to test, and just everything is falling apart. They're not even, they're just denying and denying and denying it, instead of being straight up about it. But they're more concerned about keeping the markets going. That's what this is. We got the biggest players in the world right now scrambling for every goddamn penny they can scrounge, because the markets are tanking. And you can guarantee that these people are pulling their weight and pushing their weight around. They have to be. And they got connections. You know what I mean? Of course. And this data that we're getting, this data that we're gathering, that's great for them. That's great, actually. The less data that we have on this is the better. So the fact that the United States isn't testing, people are cheering for that right now at the highest levels. Because if you can't test, well, you don't got it, right? And that's kind of the thing. So, since then, she and her friend have been in quarantine in the house, and they remaining out of contact with anyone. But they were on a flight, and she was on the flight. She had groceries delivered to her home. Like, this person obviously seems conscious and aware and genuine, concerned about other people's safety, right? She had groceries taken to her home, and she's doing everything she's supposed to do, right? And the CDC's basically backdooring her here. So they declined to say specifically what flights they were on, but insisted they provided their travel details to the CDC. And Fox 13 has reached out to the CDC, and we are awaiting official response. Yeah, that should be made aware to the general public, of course, right away. Like, that's the problem. There is no transparency in this at all. Because if you are transparent to the public, then the public can help you. Right? If you're not transparent, the public's in the dark just as much as fucking everybody else. So if you're being more open, you can track these cases quicker, right? Because if this information is out there for people to view, they can say, oh, geez, I know my friend was on that flight, and calls their friend, and that's how things happen real quick. It's not to say that these experts are going to be able to do all the legwork and track these people down, but their friends, if they're concerned, would obviously, they would work it out for themselves, right? Blah blah blah. Yeah, it's terrible how, like, the CDC is just like shitting the bed, and they have no choice because they can't test, and they can't come out and admit it, but they have. But they haven't come out and said this is exactly how many tests we have right now, because they can't. If they ever did that, they'd be shot. People would lose it. They would, because it'd be only a couple of hundred tests per city right now, like big city kind of thing. So frustration rising over the lack of access to coronavirus tests. Of course there is. People are pissed, and these guys are just they're so good at deflecting questions. They're and reporters are only allowed to get like one question in, and they can't do any follow-up questions hardly ever, right? So it's like, we just got to take whatever comes out of their mouth and just run with it. There's really no um, further in-depth descriptions. It's just, well, just take what we say and as what's true, and that's it. Just believe it. I'm sorry, no, can't do that now. So in Washington, frustration over the lack of access to coronavirus testing boiled over Tuesday as the Trump administration sought to reassure lawmakers that the nation will have the capacity for 1 million tests within days. So, I'm hearing from people who are sick who want to get tested and don't know where to go. Senator Patty Murphy told senior administration officials at a hearing. Her state has seen a cluster of deaths among patients in a nursing home, and Murray called the situation unacceptable, adding that families deserve to know when testing is going to scale up. It's still not there. They're not doing it. But you know what? This virus is still spreading. It doesn't care about our politics. It doesn't care about our shortage of tests. It's going to keep barreling through, and it's only getting stronger. Right? And my reason for doing all this is like to give people a heads up. Because if you don't know, you should know how bad this is. Really. And they're saying, no, don't worry. It's all, and people just won't, and I'm not going to explain it. And really, or not that I'm not going to explain it. I'm not going to be, trying to convince one person, it's just not, if they don't want to be convinced, if they can't see it with their own eyes, then they're not going to see it. Right. And this has been from day one. I've been following this. It's just been a shit show. It really has. And I'm deeply concerned about the handling of this. And everybody that mostly I've spoken to about it are still kind of oblivious to the situation, or just think it's nothing, or, well, yeah, unfortunately. But anyways, so, yeah, they're saying they're going to have 1 million tests. So the head of the Food Administration in the U.S. said that the FDA has been working with a private company to get as many as 2,500 test kits out to labs by the end of the week. Like, yeah, they're working to get them out to by the end of the week. Like, that's not to say it's going to happen. Each test kit should allow a lab to run about 500 tests, he said. That would work out to be about 1.25 million tests. But when senators on Health, Education, Labor, and Pensions Committee pressed on whether the government will meet its self-imposed deadline, the health officials avoided making hard promises. So it's not going to happen. Right? If they were confident and it's going to be ready and it's going to be there, they'd say it. Right? I am optimistic, but I want to remain humble. Yeah, of course. We all can be optimistic. It's not going to change the fact that the tests aren't ready. Independent experts said that they can't assess whether the Trump administration will meet its goal, but they commended the health agencies for the effort. The U.S. public and private sectors have the capacity to produce and distribute a large volume of tests, and I hope they meet the goal. They have the capacity, but it doesn't mean that we are at capacity. Not even close. Right? It's crazy. The problem was blamed on one of the 3 chemical reagents used in the testing kits. So they gotta remake this agent, right? And that doesn't just happen. This actually happened like 3 weeks ago, but it's only really making front headlines now. The testing kits were flawed a while back. Like, fuck. Oh, it's sad, man. It is, because they're just, and you see it happening, but then they're telling you another, a different story, and everything that they do say, they're cushioning it, right? Purposefully, overly cushioning it, and it just stinks because they don't even have, the ability or the decency to come out and just be honest with fucking people. But why are they not doing that? Well, that would cause panic. And that would cause the markets to crash. That would just cause everything to go into chaos right away. So the basic thing you can do in a situation like this is just keep riding it out. Saying everything's keeping on, the ship's sinking, but don't worry about it. kind of thing. And that's the nature of what they're doing right now. You know, they're giving us information, but at the same time saying, no, it's not that bad. But we're seeing like outbreaks just constantly doubling and tripling across the world. And it's frustrating. Yep. And the CDC has stopped testing, or not stopped testing, but stopped displaying the amount of tests they're doing. So, you know, they used to have a total tested amount. They're not showing the total tested amount anymore. They're only showing the confirmed. Right? Do you know why? Of course. Because they can't show the total tested amount because people are going to see that, hey, we're still not testing as many people as we need to be. Of course they're going to change that. No, classify it as some kind of fucking personal personal information, something, I don't know, right? They can cradle on anything. So what's this one? CDC. Oh yeah. Well, how long is this? It's only a second. Okay, it's not long, but here, yeah, this is the CDC getting grilled with the tests
right now.
Outrage and concern tonight from local officials as a coronavirus evacuee from Wuhan, China, tested positive for COVID-19 after being released from quarantine. That patient released from Joint Base San Antonio Lackland after the CDC cleared them. The Centers for Disease Control and Prevention announced today that patient was cleared after 2 negative tests, but a pending test came back positive. Out of precaution, the CDC has returned that patient to isolation at a local hospital. Efforts now underway to...
But anyway, blah, blah, blah. So we know that the tests are flawed. They're not working. Even if we can test, there is a 30 to 50% chance that it's going to be wrong. That's huge. Like even 20% is huge. 30 to 50? Yeah, that's we can't we can't gather proper data with that error rate. And the PCR tests, the way that they're testing these, they're so highly sensitive that they're flawed in the sense that they're too good. They're too good for their own good because it magnifies every other thing in the test. So if any kind of smallest contamination gets in there, it throws the whole thing off. All right. It's not good. So FDA chief claims 1 million coronavirus tests by the end of the week. Stirs controversy. Well, yes, because there's people that started to do the math on this. So that estimate far exceeds the number of tests that several labs will actually be able to run each day. Under ideal conditions, the nation's public health labs could run up to 10,000 tests per day by the end of the week, according to figures provided by the Association of Public Health Laboratories. So, you know what I mean? These guys are just so full of shit. They're so full of shit. But you can guarantee they're getting their families all fucking ready. You know it. But they gotta keep the public calm. That's the number one objective right now. That's the number one. It's not even the virus anymore. It's keeping the public calm or distracted. Yeah, because that's, if you lose this ability to keep the people calm, then you lose the ability for everything, which makes sense. But at the same time, in order to keep people calm, you have to lie to them. Especially when the truth will, probably upset some people. But that's going to be inevitable. Unfortunately. So widespread coronavirus testing could still be weeks away. and this is for the United States, it could be weeks before the United States can meet the demand for the coronavirus testing. Doctors and hospitals and some public health labs say they aren't set up to do the tests. How can you, there's, and now they're just saying still go about your business as usual. That's very concerning. I have to question so many things, and I've been questioning it right from the first. Since they locked down the city of Wuhan, 10 million plus people, I was kind of like, what the hell is going on here? And it wasn't even news at that time. It wasn't. It was all about the elections. I went through like top news stories and you couldn't find coronavirus fucking anywhere or anything happening about it anywhere. I was like, what the hell? There's a city of like 11 million people on lockdown and there's no news coverage on this? It barely broke headlines a week later. And then once the cruise ship from Japan docked, that's kind of when it really peaked headlines. Because they had no choice then. You can't cover up a fucking cruise ship full of infested people. So that was what really brought this to the next level on the world stage, from people taking notice to this. And then, of course, shortly after, outbreaks in the United States. And, and don't worry, they were saying. No, and right from day one, don't worry. It's all good. But here we got these countries and, the whole planet that's ill prepared for this, but yet you have the top officials lying right through their teeth to try and keep some sense of rationale amongst society. Right? Because people start panicking. People do stupid shit when they panic. And when somebody panics, it's kind of hard to stop them from panicking. You can't tell a panicking person to stop panicking. That doesn't work. I know. It does not work. You might be able to beat the shit out of them and stop them from panicking. That's about all that works. Really. You got to give them a good smash, and then it knocks some sense into them, because there's no communicating with a panicking person. Survival tips 101. So FDA commissioner said Monday by the end of the week, U.S. labs would have enough materials to perform close to 1 million tests. That figure is misleading because it is far larger than the number of samples that can be processed in the labs. So yeah, just because even if you had those tests to process those tests, and then you need the people, the scientists, the lab technicians to validate and study these tests. Right? So we have a big problem. And they're not admitting it. And they won't, I don't think. The number of public wants to know is the number of people that can be tested per day, not the number of tests sitting in a warehouse. That's actually makes sense. They really want to know how likely it is they can be tested if they show up at their doctor's office. Democrats on Tuesday slammed the administration handling of the botched CDC tests and the pace of efforts to increase testing capacity. Well, you can't increase testing capacity if you don't have the tests to test. Right? You just can't. And we don't know anything about this virus specifically, which is, I don't know if they actually don't know anything about it or if they're just saying they don't know anything about it. We don't know if it's mutating in the sense that maybe they have to develop another test because the old test for some reason is not detecting this new strain, or I don't know. It could be a million reasons, right? And we don't have a handle on any of them. But that just kind of concerns me too, because I firmly believe that there's more than one strain of this going around. I firmly believe that there's got to be a mutated version of this out there tripping around somewhere. And I don't know. That's my kind of theory, because just considering, I don't know, there's a lot to consider. But it would make sense, coronaviruses are highly active in mutation, right? So it would only, in a population where in China where it infected, countless people, let's say, the chances of it mutating increase as the more people get infected with this, right? It has a pretty good chance of mutating in a population of, let's say, 10,000 people. But let's say in a population of 10 million people, it might have a really goddamn good chance of mutating, and not only mutating, but having a sustainable mutation. So we don't know. There's so many questions, right? But it's none of them are really being answered. Every kind of question is just being deflected. And anything that is concerning that comes out, well, they downplay it really quickly somehow. They're good at that, right? But we know now that it's slipping through the fingers, and on so many levels. And you really have to take your own safety into your, do it yourself. Don't wait for these people to give you any advice, because they want you to keep going, business as usual. Keep going to work. Keep doing your thing. I stopped doing all my regular activities. I think it was on the 26th of January. 23rd or the 22nd, I started following this. And as I was watching, I stayed up for almost like just countless hours, like 18, 20 hours a day, absorbing all this information coming in from China, because it wasn't really restricted at the time. But nobody was really paying attention to it at the time. There was a copious amount of information that was constantly being uploaded and discussed on lower platforms, but it wasn't in the mainstream media at all. And that was enough for me to, information at that time. After just a couple of days of watching this, I was concerned enough that I took precautions and I kept my son home from school. And, you got to. In certain situations, if you feel like you got to do that, then you got to do that. And that's what I felt I had to do. And I did that. And a lot of people are kind of questioning my motives. And, well, it's hard to explain it to somebody if they're not paying attention. You can't explain all the information that I've absorbed in the time that I've absorbed it to any conversation. In the gravity of especially, of somebody who's not getting it, right? It's only going to create me to be winded in the sense of trying to explain it also. To somebody who definitely doesn't probably even want to acknowledge that it's happening. So, yeah, inexplicably also, CDC's public webpage no longer displays the data on how many persons have been tested or for who have died from COVID-19 on the CDC site. Right, cases 104. Well, that's gone up since then. I think we're up to like 130 now. I think we're around that for the United States anyway. But that's official numbers, right? We can only assume and actually pretty well guarantee that there's much more cases that aren't being caught in the community. We're not seeing them because of our lack of capabilities of testing, and also probably because it can be transmitted with people who are showing little to no symptoms, and almost not a lot of people are going to go running to the hospital over a little bit, right? It's going to be people that are, more worse, or maybe somebody who's like a germaphobe would be running to the hospital to get tested every 5 minutes. You will have those people too, right? And that's going to be an issue for the hospital, because these people might not have it at all, or and it's like, well, we only have so many tests, we just can't, so they're going to have to triage this into a sense where it's like, well, the possibility that you have this is greater than this person, will test this person. And that's going to have to happen, just considering the situation with the lack of tests. So about 8% of Iranian parliament MPs have tested positive. Tuesday, 23 MPs had caught the illness. Well, if 23 of them came back positive, you can almost guarantee that they're all going to be positive, considering how infectious this specific virus is. And it's absolutely, it's epic in a viral way. Like, in a viral world, this thing is king of the fucking castle. And I'm not sugarcoating it. It shows it has some very unique characteristics with its infectability and how it infects us. The communication it does at a cellular level to infect our cells is very, very curious, to say the least. And it's not like any other coronavirus we've ever had. And we've never had a virus that is a respiratory pathogen that has been spread like the flu. This thing is in fact airborne, if you want to say that like a military term, or if it's if you want to use the word vapor or aerosol, whatever floats your boat. But this thing, in a setting where people are gathered, let's say for Congress or whatever they do, like in their governments, that's you got 23 people infected in that room. Your chances of catching this are pretty well skyrocketing. And they're very, very traditional people. They have very they have a unique culture that they're very intertwined. And yeah, so it would spread there like wildfire, you could imagine. And the numbers are numbers. They're really, at this point in time, we can just say variables, because there is no, they're so dynamic that you could look at it for 1 second and then it's changing. It really is, because it's only infecting more people, so it's only growing stronger, right? The Middle East and Europe, South Korea, where authorities declared war on the virus after 582 new cases, took it up to more than 5,000 with 34 deaths, contrasted with the apparent optimism in Beijing. Yeah, well, Beijing, China's on this, I don't know what you want to call it, propaganda machine that they're trying to unroll here, to say that their numbers are going down and everything's subsiding, and it's all good, we're going back to work and we're opening factories. And well, they're going to try and open factories, but do you know what they're doing? They're taking all the Ugandans, or the slaves that they have up in the north in these slave camps, and they're transporting them to the factories and forcing them to work, because the other people, the factory workers, are sick. So they're going to take these people in, these slaves, and they're going to truck them into the factories and try to get these factories off the ground. It's not going to work. They're just throwing fuel on the fire. But that's what their plan is, right? And everybody's quarantined. The quarantine measures are not lifted, so everybody's still at home. How are you going to test people? And if the United States can't test people and the rest of the world can't test people, how the hell is China going to test people? They were at a test kits a month ago. That's why they switched their criteria for diagnosing it. And then it skyrocketed. It went to like 10,000 cases in one day. Well, that wasn't good. So they had to change that again, and they did. So they went back to the PCR test, which they don't have. They don't have it. They don't have it. They were begging the EU for help, like by the end of January. And the United States was offering a team of experts to go in, and China was denying them to go in. And right there, it's like, well, why wouldn't you want people to go in and try to figure out what this is? They flat out, the US has only got, I don't even think they got in there yet. But the World Health Organization was there, and their team of experts. And there was a Canadian expert that was there as well, infectious disease expert. He went along. And I don't know what the hell to make of these people. I really don't. But it's just going from one level of incompetence to the next, because they're not being honest, and they're tripping over their shoes, and the data's coming out now that supports that they're bullshitting. They're full of shit. They really are. And they say here, WHO staff member in Iran has now tested positive. He has a mild disease. All right. Yeah. When the World Health Organization's people start getting infected, you know it's goddamn serious. But hey, no, don't worry. Just keep going about your whatever you're doing. And Kirkland, Washington, yeah, unfortunately, they got a major problem with that nursing home. Major problem. Yeah. It's an all-out outbreak there for sure. And like, these people aren't, look at this guy. Doesn't even got gloves on. They're transferring infected patients. What the hell? Like, is it the fact that we just don't have the supplies to give people? Or is it the fact that these people are undertrained? Or is it that they just don't give a shit and they're probably already infected? Like, what the hell? I don't know. I don't understand it. But they're definitely, like, this guy definitely holding the sheet is, I'm sorry, bud. You know, that's definitely not a good barrier for, you know, a virus. Especially if this person may be, let's say, a super spreader. We don't know how infectious these people are, how much virus they're actually shedding, right? It could just take just being within a couple of meters of these people, maybe. You know, they're breathing. You know, just because, you know, we're thinking, oh, we're outside, but these particles are constantly being, you know, breathed out of infected people. And actually, they say you can actually, it's kind of funny, but you can contract this through somebody who passes gas or farts. Because I know it sounds crazy, doesn't it? But in fact, it is true. So people with gastrointestinal illness that were showing the symptoms of this virus, which is not really, you know, common in coronaviruses, but in this one it is, that they can actually be infectious through the particles that are expelled, you know, for sure, right? Because they're doing tests through oral, anal, nasal, and serum, all these different methods, right? But the anal seems to be the most, the one for, I guess, gathering the best data, if you wanna say that, but that's what they're saying anyways. The tests that they're gathering, they're saying that the anal swabs or rectal swabs are more accurate than the nasal or oral. And that's concerning because, you know, like somebody who is just, like, if you can smell it, think of this, if you can smell it, then you're probably breathing in those particles. Seriously. And that's how infectious this actually is. It's crazy. So we got 12 firefighters also in Kirkland who showing flu-like symptoms because they weren't given the proper equipment or proper training. They didn't know what they were going into. 12 of the 30 firefighters and police officers in Kirkland who have been quarantined after potential and direct exposure are now showing flu-like symptoms, according to City of Kirkland officials. How many, their families infected? The other people, do you see how bad it is in Washington right now? It's gonna explode in Washington, in Kirkland, in Washington State. And actually everywhere. It's just a matter of time, but this is going to be the big one for the States. And it's probably somewhere along San Francisco, California, somewhere. It's probably going to be the next places. Boston is now, I don't know, Boston's got an issue. A lot of people. Toronto, BC, Vancouver, a lot of people have problems with this. The firefighters and the first responders go down, right? That's terrible. And here we are, or I don't know, CDC, it's not me, but CDC and our higher ups are exposing these people and giving them very limited training, right? And very limited protection, it seems. We go back into this picture here and we look at this guy what the hell, dude? Got short sleeves on, it's a nice day. Yeah, it's great. It's sloppy. That's the sloppiest thing I've ever seen. And I've seen some sloppy things. There's a big problem with the chain of communication for prepping our first responders. These people are our fucking frontline defense, and you can't even have the decency to properly equip them. Or if it's not the decency, then it must be the lack of actual equipment. Or this shit will be everywhere. Why wasn't it everywhere? We knew this was coming for a month now. On the media and stuff, we knew it was coming. There was cases in the States. And there's nothing really been done. Nothing. Doctors started calling out the CDC on their testing capabilities on national TV, so they had to do something. But yes, they did something. They said they're going to do all these great things, but nothing's changed. The situation hasn't changed. It's only words that were spoken. Nothing has changed except that the situation is getting worse because we can't test for this at this moment in time. We don't have the capacity to do it. In the United States anyway. I'm up in Canada. We're not testing that much either, but I think we tested maybe about 5,000 people in Canada. I don't even think the United States have even tested 1,000 people yet. Because it was only 500 in some tests 2 days ago or 3 days ago. So, it's rough, right? And here, coronavirus patient works at the cancer unit, looking after terminally ill in the UK. The UK's got a big outbreak too, right? I don't know. They say they do, but they only got 58 cases. But the lack of capacity to test for this, they know that, they're not just going on scientific numbers in the UK. They're looking at this and saying, hey, well, actually, if we have this many cases here and we have an outbreak here with these many people, considering, the RO value and considering how long this has been traveling, considering the latency value of how long this becomes before people show symptoms, before you become infectious, all that has to go into the equation. And then it gets, it's an answer that can come out of that. It might not be solid scientific answer, but it's an educated guess of what you are experiencing in your community, and that's what they did. They took a look at this and said, actually we can't go with the numbers because we don't have the capacity to test the numbers. Right? The UK's got 51 cases. and no deaths. 51 cases and no deaths. And the UK is on fucking, they got the army like on standby. It's crazy. They shut down 120 schools. Like they're in complete lockdown mode with 51 cases and no deaths. So obviously they know how to, estimate how bad this is, right? But everybody else is so concerned about concrete data in the US and the CDC and the World Health Organization. They will never come out and give an estimate. It has to be exact. If it's not exact, they say, well, more testing has to be done, blah, blah, blah. Just a garbage answer, right? It's a closing statement. Washington facility orders teleworker employees to work from home, and that's the Department of Homeland Security. In case you were wondering, they're asking their staff to work from home. Department of Homeland Security in the States feeling the effects. Nursing home outbreak spotlights coronavirus risk in elder care facilities. Well, not just elder care facilities, in all facilities. Anywheres. It's not necessarily just older people that are contracting this. Anybody will contract this in any situation, in an airplane, in a workspace, in a restaurant, in a taxi, in an Uber, in a train, in a plane, in a bus, in a log, fuck, anywhere. You know what I mean? It's not just this place, it's all facilities. But the care facilities, yes, they're going to be most vulnerable. They're going to be most vulnerable because they all have underlying issues. And they're all at an extremely high rate of unfortunately succumbing to this. And they are. I think it's up to like 13 people there at this one nursing home that died. Since they figured this outbreak was going on a week ago or a couple of days ago. And they only tested the nursing home because I can't remember how it went down. I think it was one of the nursing staff that got tested and she came back positive or something, and they tested the nursing home people, and basically everybody's infected there. Of course they would. Nurses are they go into every room, and they're conversing with other nurses. They talk with other nurses. They eating together. It would have just infected everybody. That's how it's spreading. But they're not really telling us the gravity of this situation in the headline news for the most part. You got to dig through the science and get the bottom of the barrel kind of headlines. Not to say that it's not valid news, but it's just not being headlined, right? Amazon employee in Seattle test positive, and this is like at the big headquarters too. And it's one of the higher ups. It's like not a factory worker. This is a higher up employee, and he went home sick on February 25th. He went home on February 25th and later tested positive. So, this is a week later, right, that we're getting this information. But he did go home. His family, of course, is probably infected. And then even if he was sick, he might have infected his kids or his wife or whoever. And they might have been continuing their daily activities out there infecting people. Do you see how fast this spreads? It's a chain reaction, and once it starts, you can't stop it unless you completely dramatically take some dramatic action, right at community level, at street level. It has to happen, because if you don't separate the people, it's just going to keep spreading. Unless they just want it to keep spreading, because that almost seems like what they want right now. Because the New York mayor said, "Don't worry, we only got 2 cases the other day." He said, "Dad, don't worry." Mayor Cuomo said, "Don't worry, we only got 2 cases." We want everybody to continue business as usual. He said, go to your works, go to your school, go do your thing. That's exactly what he said. And you can't do that. Just because people look at it and say, oh, it's only 2 cases. You think they caught every case that is in New York? Do you know how many direct flights came from Wuhan alone, not just China and Shanghai and Beijing, but do you know how many flights came directly into New York? There's a lot. Before all this even made headlines, the outbreak was happening and there was no travel restrictions at all. And I was pulling my hair out going, what the actual F? Like, you guys got to stop travel. But no, they didn't. It wasn't until they started detecting cases that they stopped travel. They're so concerned about the markets and about the lack of data to support evidence to shut things down or make a call to do something of this nature. Well, just because we don't have, the exact numbers, we know that infected people are definitely flying out of that area. Those people definitely infected other people. And it's been going on for 7 weeks or so. In full outbreak. In Wuhan, when this thing was in a full outbreak, people were still flying and leaving, and because the Chinese government refused to say anything was happening. But and then the travel restrictions came in place, and what did they do? They took people's temperatures. That doesn't work now. We know that. I knew that at the time. Because, just because you're not showing symptoms doesn't mean that you're not, it's not like you get this and then you're infected, and showing symptoms within hours. It takes a long time for you to show symptoms with this specific virus. But, we still don't have the data that we need on this, but there's definitely data supporting that it's longer than 14 days. And that's it's disturbing. It's very disturbing. Oh, what else is going on here? Yeah, this is in the UK, so the army could be deployed. The British Army could be deployed in Northern Ireland, or sorry, not the UK, to support authorities in the outbreak. So Ireland's got an outbreak. We know it's not big numbers, but they're being aware about it. They know what's going on. Let's see the numbers of Ireland right now. Ireland has 2 cases, and they're thinking about deploying the fucking army. Northern Ireland. And they're going to deploy the army over 2 cases? What do you think? I think that they know that the numbers, even though that we're catching them, are not the numbers that are actually happening. Not even close. Because we know how bad, or know how, I guess, we know how fast this can spread. Because it's extremely viral. And here, the Chinas are, this is a whole nother can of worms. But worrying cases of recovered patients in China testing positive again have raised questions among doctors about the criteria being used to discharge people from the hospital. My personal opinion on this, I did a couple of streams before about how this affects our ACE2 receptors and our CD4 cells, or our T cells. It binds to our immune cells in a sense. In a way, this virus infects us in a way that it tricks our system to thinking that it's not recognizing it as a threat. So our system allows this virus to fuse with our cell. Now it's an endocytosis, or I think some kind of process like that. But what it does is that once it gets into the cell, it has the ability to hide from the immune system. Which while it's hiding from the immune system, it's copying and replicating virus inside our cell. But it has the ability to turn off, let's say, these signals that allow it to be detected, which goes almost into a state where it's like a biphasic virus, where it can, or maybe it's going into like a dormant state or a remissive kind of state, because we know HIV has those characteristics to do that. And we know that this virus does have HIV characteristics in its glycoproteins. So, these message centers are very crucial and very unique and very intriguing, to say the least. Because if it can actually do this, our tests are useless. Absolutely useless. Really. Because, if people are infected and this has a way of, people kind of get cured of this, right? People get supplemented oxygen and they get some little bit of minor care at the hospital, and it's usually not bad. But then some people are going into like a very severe state, like a pneumonia, right? And starting to get liver failure and organ failure from this, and secondary infections. So are these cases, it's a lot. I'm not going to get into a whole lot of that, but my point being is that I think it goes into like a sleep state. When these people are getting better, this virus, and when they're testing negative, maybe the virus isn't it can't be detected at that point, because these tests, we use these PCR tests are relying on this specific reaction to take place in order for us to target this specific amino acid or whatever they're looking for. And if that's not there, the test can't see it. But if that would not be there, let's say if the virus in fact can go into like a sleep state, kind of, or like a state where it can in fact hide, and then it starts like like a biphasic thing where it reinfects, right? It'll reinfect you again, and it gets worse. So there's a lot of science that's definitely really intriguing about this virus that's never been found in any other virus that we've naturally known to have, all in one. It's funny. It's funny. So France closes 120 schools. And actually, I should say it's not funny. I mean, it's concerning. There's nothing really funny about it, but it's funny in the sense that, like, do they really think that people are this goddamn stupid? Maybe some people, but you can't fool everybody. France closes all their schools. Let's see how many cases France has. France is, 212. Yeah, they got a reason to close schools. They got 212 cases. The U.S. is closely behind with 125, and everything's business as usual. Nothing to see here, folks. Nothing to see here. So this is France supermarket on Sunday. If anybody wants to know what it was like to go shopping in France on Sunday. But anyway, yeah, you get it, right? It's just a lot of people. And they're limiting the supplies people can get on toilet papers, on like necessity things. You know, you can't go in there and just get it like 20 packs of toilet paper. I think you're limited to like 3 packs or 4 packs or something. And this here is a new one. A woman at a Sydney, nursing home, again, another nursing home. Investigations underway whether the 95-year-old nursing home resident died from coronavirus, because there is in fact a person who works there that has now tested positive. So a staff member has tested positive at this place. And another 11 residents are also being isolated. Confirmed the female employee at the home in her 50s worked at the Baptist Care nursing home, where there are numbers of different residences on the grounds. And it's the 3rd case of human-to-human transmission in Australia. The United States has its first case of human-to-human transmission, officially. There's probably lots of human-to-human transmission, we're just not catching it. But officially, we do have, or the United States does have, human-to-human transmission. Yeah, this person. So a man tested positive for coronavirus after leaving Iran, and gets to Tasmania. Went to the hospital, entered self-isolation at home until the results came in, but he did go to the supermarket to stock up on things before he returned home. And he did, in fact, come back positive. Be very careful at the supermarkets. At any place where, people are gathering in large numbers. And sports events are going to be canceled soon. We're already seeing it happen in Italy and all these places. Like the NHL, MLB, Major League Baseball, hockey, basketball, and baseball. Like, everything's going to be shut down. It will have to be. Toronto's got 20 cases. I guarantee the next Raptors game is not going to happen. If they do, it's oh my god, it's just another sloppy mistake. Because nobody wants to admit the gravity of this for some reason. It's like, what the hell? You got to come out and be honest with people at some point. It's obviously like exploding, and we can't get the numbers because we don't got the tests, right? And this is gonna make for some one hell of a documentary, in a couple of years' time. The Coronavirus Project. Something like that. So, a lawyer is in severe condition as well. New York City lawyer. In his 50s. His son is also being tested. Family members, you know what I mean? Oh my god. Actually, we'll stop with the drama news for a minute. Let's learn how to make hand sanitizer. Considering that there's none available anywheres. And if you can buy hand sanitizer online right now, it's going for $125 on Amazon. Go check it out. Purell hand sanitizer. The big bottle's $125. Face masks are going for like hundreds of dollars. That's just sad. You know what I mean? People like that, those ads shouldn't even be allowed up there. Amazon should fucking be allowed, should have to take them down. Anything that's a markup in a crisis situation, those people should be taken out and fucking beaten and hanged. I'm sorry, but if you're taking advantage of somebody's, basically the whole globe's problem now, your money's not going to go too fucking far, I promise you, in the long run on this scale. So, it's probably better if you just kept them for yourself if you had them. Unless you had thousands of them and you wanted to donate them to some medical place or some frontline workers or something, yeah. But you know, you got to take your personal safety into consideration as well, right? People are just like, well, I'm going to take advantage of this and charge fucking like 1,000% more than like what these products are worth. Sad. But anyways, it's a pretty easy way to do this. You just got to get some aloe vera gel, and rubbing alcohol, isopropanol. You can get to 60% or 70%, and just mix it. Mix it into, I think it's like a third. It's not. So yeah, start with less than 2/3 of a cup of alcohol, and you use 1/3 of a cup of aloe vera gel. So yeah, that's not bad. And then you get a cup. You basically get a cup. But if you know, careful when you're mixing chemicals. I know, you know, make sure you put your PPE on. Oh shit, we're in for it. So here we have the hospital in Iran. This video, I'm going to show you this video, and this was leaked out of Iran a couple of days ago. It's just like China. It was just like China's videos that are coming out, right? Like all those people, that's those are dead bodies, right? And we seen the big body piled up in China, right?
حجم اموات خیلی زیاد هست و هرچه انجام میشه ولی تموم نمیشه. اینا همه کرونایی هستن که باید شسته بشن. اینا همینجور، اینا همه متاسفانه کرونایی هستن که باید اون اتاقم این اتاقم متاسفانه بعضا جنازه ها مال 5 روز 6 روز پیشه. به عنوان مثال این پیکر مرحوم خسرو شاهی هست که
But yeah, right. And that guy's probably infected.
چند روز اینجا مونده و هنوز تجهیز نشده. وضعیت خیلی وضعیت اسفباریه. خداوند انشالله.
But you know what I mean? Like that's just like one day. And it's crazy. Here's another video. People in China fighting, of course, you know, because tensions are high and like this person doesn't have a mask, and you know they're kicking the shit out of people because you're not wearing a mask. And everywhere else in the world is saying don't buy a mask. In China they're saying if you don't have a mask we will kill you. Basically is what they're doing. You know, it is. Society's breaking down. Okay, I'm gonna full screen this for you guys. Or actually, I'm gonna try to. I'm gonna go grab a quick cigarette and have a puff. And yeah, these are the latest videos coming out. So you know, take them with a grain of salt, but at the same time, you know, everything fits the situation because people are all suited up in quarantine suits. They got masks on. It's a viral situation. They're kicking the fuck out of people for no apparent reason. It's a breakdown of society, and that's what's going to happen in most other places. But in China, the people are scared of their government. The rest of the world, governments are scared of the people. We're going to see how that plays out. All because he wasn't wearing a mask, right? Like, these people are just savage fucking douchebags.
是为民除害。对的。
干着，等人干着，你别把人大号，大号，快干着干着。搬出来！大眼的，把干着！还写完整还写完整，你个狗日的样的！我写呀你！什么时候啊？我就看着不了。行。县城国际县城过来，这边还打，完全把当二边封。是不是快点？是不是个？是不是大？俺去的，能不能在一起找个地方？对不对？是。看，你这是哪里？走，这杠，这杠的啊！这把是不是还？哎呦！啊！怎么去？这么叫来就狗子？
呀！还往前上，这个时候你还往前上啊？这啥时候还往前上？有没有你就往前上？别了！你不要！有没有你就往前上？是不是呀？我了。有没有你就往前上？再上手！没有呀！杀手！快点！唱歌杀手，听到没有？杀手再走！不让杀手听没有？哎，你干啥呢？我他妈乡里的！
大郎，该吃药了。今日新又抓的，专治大郎的病。大郎要是不喝药，不是比奴家去死吗？
不在，不在就不在，你不在那说是对的。什么不在，你还有理？抓呀！赶紧抓！不抓我死了！赶紧抓我呀！不抓我死了！不抓我死了！抓呀！
是
口罩戴起来。
警告你，出去不出去采取强制措施啊！
快点的口罩戴起来呀！
到哪里？在银行拘留了，听到吧？到哪里？
晓得安宁服务的啊。
快点！
新的3次警告，拒绝非要强行抢关。
走，那只手，那只手，打过！
小区进行出入，可在小区内活动，一律佩戴口罩。
来了，
快！
你往那站着，加油！妈逼，咋谁跳人娘了个逼！妈的，敢弄老子跳人娘！你鞋都没地方穿！妈逼，我就带着你叫呢！狗死嘞！
你真是原来精神有点毛病，你知道吧？
妈逼，你带都管不上，你受不了。穿点，
你别管他。
老子不敢让你带药掉，我不姓李。妈逼！妈逼，这还不是这样人？放你娘了个屁！放你妈了个屁！你他妈的跳人家！你打老子！妈打你了！你跑了！打谁老婆亲家？多少人睡过他跪倒在这边？妈逼！25，看不起你！
吐的他。
你咋？
Yeah, my apologies for that. I'm back now. Yeah, this is kind of freaky. That's some scary shit, eh? And they're saying that the kids aren't affected as much. But I have another source. I have another source that says otherwise as well, unfortunately. But yeah. Obviously a viral situation, everybody's got masks on. Right? There's 3 right there in that one bag. In that one hospital. Right? I don't believe anything that they're telling us about this. Nothing. Let's yeah, again, this nursing home, a case of not enough protection. Like, look at them. Like they're, like these people are not in. Oh my god, right? Like it's just like this cop standing here or whoever he is, firefighter in the black. Like unbelievable, right? These people are way under protected, and these are our frontline people. What the fuck, dude? You know what I mean? Some bad shit, dude. And I can't help but only think that the only reason why is not because of lack of information. Not because of lack of information, but because of lack of equipment and safety equipment, right? Oh fuck, I really believe that. This here is in Hong Kong. This is about a week ago. But the protesters are at it again. Yeah, they're just like trashing the place. Yeah. I'm not sure what this is. I can't remember what this one was. I put it up, so let's watch it. So they're saying that total infected in Iran is over 20,000. And 28 deaths. That was like a week ago from the government. But they burned. There was a place where they were housing the refugees, or not refugees, but the quarantine people. And they set it on fire and they burned it down. Now, I don't know, but they're like dumping bodies beside this guy's house and just burying them. And like these guys are all in hazmat suits, so it does fit the criteria, right? They're just dumping people wherever they can, I guess. You think they would do it further into the city, but
گفتیم اونورتر دفع کنید جای دیگه آتیش بزنی حرف گوش نکردن حتی خانواده‌شون جرئت نکردن بیارن جلو
people are like going, what the hell, get these people out of here, right? Of course. Oh no, it's a lot. China officials knew coronavirus in December. Ordered cover-up, report says. So, Chinese scientists knew about the coronavirus and its deadly effects as early as December, but were ordered by government officials to suppress the evidence, according to a report. In late December, several genome companies tested samples from sick patients in Wuhan, the center from coronavirus outbreak, and noted alarming similarities between their illnesses and the 2002 SARS virus, the Sunday Times of London reported, citing Chinese businesses Klaxon Global. So researchers alerted Beijing of their findings on January 3rd, received a gag order from China's National Health Commission with instructions to destroy the samples. Rather than hunkering down to contain the virus, Wuhan officials went ahead with their annual potluck dinner for over 40,000 families. The alleged cover-up continued when representatives from the U.S. Centers for Disease Control and Prevention on January 8th visited Wuhan, where officials intentionally withheld information that hospital workers had been infected by patients, a telltale sign of contagion. News of the virus' highly contagious nature didn't surface publicly until January 20th. Wuhan was locked down and a mass quarantine was ordered 3 days later. Yeah. They said it was out of control. Like all these crazy videos that we're seeing, like people passing out in the streets and stuff, those were taken around the 16th to the 23rd of January. After the 23rd, everything stopped. Like after the 20th, well, pretty well everything stopped, but the 23rd is kind of like nothing came out of there after that. Because China has one of the best censoring platforms on the planet. They are world leaders in it. And here, China, they detained an activist who called it the cover up, right? This guy who put out the report, so they went and fucking arrested him, right? And that's what they've been doing with the reporters. That's what they've been doing with everybody. And now we have Beijing. This is new. They're blaming America for the virus now. Of course. Amid a national meltdown, despite a desperate patient's anger at cover-up and economic crisis, a virus breaking beyond its own borders, and the Chinese government's priorities were clear. It was time to publish a glossy book on how wonderful Beijing's handling of the virus has been. Yeah, Beijing, they're commending themselves and saying that they did such a great job and that the numbers are going down and everything's all good. Oh, China reported I think only 100 and some cases recently. Their most recent number was only 100 cases, and I don't even think there's any deaths. There might have been a couple of deaths, I don't know, but it wasn't very many for sure. And you got to think all these people are in quarantine in their houses. Most of them are barricaded in, or the government actually went as far as welding people's doors shut. Yeah. So yeah, China's trying to turn it around and make it look like America is the problem, and they're blaming America for China's economy. Like in state media there, right? In local Chinese media, that's what they're saying. They're saying that it's America's problem. And Mike Pompeo accuses China and Iran of cover-up. Secretary of State Mike Pompeo accused China and Iran of suppressing information about the spread of the coronavirus. The U.S. diplomat spoke to reporters about the intentional effort to combat the everybody's calling it out now. He said the lack of transparency in China and Iran has interfered with other countries' abilities to respond. Well, it's not just Iran. It's everywhere. It's with the lack of testing capabilities. Even if we just can't test for it, so that's just the way things are right now. There's no tests, or not that there's no tests being done, but definitely not even close to the amount that need to be done to figure out where this is. But I think we all know where this is. It's everywhere. So you just have to be very careful. The Chinese scientists raised alarm over the coronavirus in December, but the government ordered the cover-up. Yeah, and this is another news source from that same claim, right? SciAx and Global. The researchers told Beijing about their findings, and they were told to keep quiet about it. It's just a shit show. It's almost like China wants it to spread. But here, let's just take a quick peek at what Senator Tom Cotton has to say. If you already seen this video, then you know. But yeah, I'm going in for another quick cigarette and finish my coffee because I never got to the last time. I realized I was running out of time. Didn't want to keep you guys waiting, and I kind of don't want to. I kind of want to keep a little bit of stream etiquette. I'm not really a streamer, but I'm trying to progressively make my streams better, so they're more informative and people are being caught up to date. So, anyways, here's Senator Tom Cotton on his stance of what about China's transparency.
Story in the world, the Wuhan coronavirus. This coronavirus is a catastrophe on the scale of Chernobyl for China, but actually it's probably worse than Chernobyl. which was localized in its effect, the coronavirus could result in a global pandemic. While you were all sleeping overnight, the number of diagnosed cases in China increased by 30%. Now, let me be clear, that's not new cases, that is just newly admitted cases. It is probably several orders of magnitude higher than that. Also, while you were sleeping, China now has its entire border with Russia closed. 2,600 miles, Russia has closed that border. El Al has shut down travel between Israel and China. Air France has shut down travel between China and France. And that's in addition to all the other countries that have already shut down travel. From what we know so far, and there's still many unknowns, this virus could have both a long incubation period, as much as 14 days, and individuals could be contagious while asymptomatic, which was not the case with SARS in 2003. Furthermore, from some cases, it appears that the virus could be aerosolized, which means it doesn't require the kind of contact that you have with, say, a married couple kissing each other or a family living in close quarters in a hotel or apartment, but rather the distances we are all sitting apart right now. Yet China is still lying about all of this. They've been lying about it from the very beginning, and you don't need their history of lying about SARS in 2003, though it is relevant here. You just have to see what's happened over the last 2 months. We now know that the first case manifested no later than December 1, even though China didn't reveal it to the WHO until a month later on December 31st, when they continued to hide it from their own citizens. And they continued to say that it had been contained inside Wuhan. Today, it is in every single province in China. They also claimed for almost 2 months, until earlier this week, that it had originated in a seafood market in Wuhan, that locals had contracted it from animals in, say, bat soup or snake tartare. That is not the case. The Lancet published a study last weekend demonstrating that of the original 40 cases, 14 of them had no contact with the seafood market, including patient 0. As one epidemiologist said, that virus went into the seafood market before it came out of the seafood market. We still don't know where it originated. Could have been another seafood market. Could have been a farm. Could have been a food processing company. I would note that Wuhan also has China's only biosafety level 4 super laboratory that works with the world's most deadly pathogens, to include, yes, coronavirus. Now, look at China's own actions. They have quarantined 60 million people, 60 million, more than the entire population of our West Coast. They've shut down schools indefinitely. Classes canceled nationwide indefinitely. Hong Kong, a part of China, has basically shut down all travel from the mainland. That's why it is essential that we immediately stop all travel on commercial aircraft between China and the United States. Making exceptions, of course, for American citizens to come back, as we just brought back yesterday, allowing essential trade to flow as long as crews on ships and aircraft are not allowed to go into the general population in America, and making exceptions, of course, for medical personnel to go into China to try to get a handle on this. It is essential that we take those steps, and essential that we get to the bottom of China's deceit and incompetence on this measure. And gentlemen, I raise this with you because you are responsible in your combatant commands for some countries that have the most fragile public institutions, to include the most fragile public health institutions in the world. So I ask, even though as of this morning there are not yet confirmed cases of coronavirus in your combatant commands, though I suspect there will be soon, what is your assessment about the ability of the governments in your combatant commands to handle a potential global pandemic like this, General Townsend?
Thanks, Senator. So there are not, that I'm aware of, any confirmed cases, as you mentioned, but there are some suspected cases. The first report of suspected case I've heard of is in Djibouti, which you would imagine with a significant Chinese presence there. So the capacity of African nations to deal with this problem varies widely.
Yeah, we'll just stop that there. Of course, you know, the poorer countries are going to have problems testing with this. So everybody's having problems testing with this. And it's contributing to a lot of, well, actually a shit ton of misinformation. So the next big news headline is the Grand Princess cruise ship. Well, this ship has already sailed and came back, and it has now been confirmed that a passenger on that voyage was in fact infected, and he is now in serious condition, critical condition. Second passenger test positive after returning home, and is in critical condition. And this cruise ship went from Italy, or no, it didn't go from Italy. It went from Mexico to San Francisco, or from San Francisco to Mexico. And yeah, and I guess this person came back. There's still not much information about this. Still developing as we speak. But yeah, let's just maybe see what is going on in the local or global news, I guess. Latest updates. Brace for more disruption. That's a vanilla way of putting it, really. You know, it's gonna have to come to quarantine. Global mortality rate reaches 3.4%. So I don't believe that number's right either. Unfortunately, I think that number is gonna be maybe without the decimal there. It's probably more accurate without the decimal at this point, considering the lack of data that we have coming out of China and Iran, and the case fatality rates in Italy is absolutely astronomical. And they keep telling people, well, you know, it's underlying issues, and well, that may be, but it's not going to stop the fact that our healthcare system and our frontline systems are going to get overloaded. It's just going to happen. We don't have the capacity to deal with this type of an outbreak, especially in cities, big cities, where it's actually got a real good foothold in Washington State. Unfortunately, the nursing home there, and now they're confirming at Washington State that there is community transmission. Of course there is, but they're now just confirming that they have now officially detected it. You know, not that it hasn't been happening, but now they're just detecting it, which means the latency period from somebody detecting this, you know, it's a big thing. It's a hard thing to detect, especially with one of the worst flu seasons of the year happening right now as well. That's major, right? You gotta triage these patients who are just having flu symptoms and just have the flu, you know, and people who are actually infected with coronavirus, which is a hard thing. You know, you could just imagine the pressure on the front line. It would be, especially in Washington, right? Like these, yeah, it's, of course, it's madness. Braces for you may need to take a 2-week break from your life, CDC says. 10 hours ago. I missed that. Has ramped up testing. United States exposing hidden cases of disease transmission and death. Center for Disease Control and Prevention are urging citizens to do their part by stopping the spread of the new virus, including taking extended hiatus from their daily lives. Hiatus, is that how they're gonna call this? Well, we call it what you want. You know, it's just gonna be a vacation for a little while. You know, everybody's gonna have to do it. The whole world is gonna have to do it. The whole world. And that's the only way. Everybody's got to go in for vacation, and the way that to make this happen, right? Considering this is a global threat to humanity itself, right? There's no more trying to contain this. It's now about preserving what we can. So everybody's got to get on board with this, from the little mom and pop shops to the big corporations. It's got to all happen. Community level, provincial level, state level, global level, country level, all that kind of stuff, right? And they have to get, let's say, incentives. Let's say free power. You can't charge people for power and utilities. And you got to make sure communications, free internet from like all these companies aren't. It's not like they actually cost them fucking money to run the internet to your house. It costs them to run the lines and to fix the lines and to repair them and all that kind of stuff, and pay their staff, yeah. But if nobody's working, except the essential services, everybody's got to get on board with this, right? So in stores, at store level, they have to make items, readily cheap, but at the same time distribute them in a way that people are gonna be able to get what they need, right? And there's gonna be enough for everybody, that everybody isn't hoarding things, because you can be prepared and you can be comfortably prepared, but if everybody prepares comfortably, but if everybody prepares, starts like going overboard, it's gonna shit the bed, right? It will. It can take place. It can happen, but to get that kind of action to actually do that, will they actually do that? Right? Will they say fuck the money, fuck monetary value right now? This is about saving the human race. This is about me, you, my next door neighbor, fucking everyone across the globe. This is everybody. Right? So what are we gonna do? Right? That needs to be the focus right now. And I'm surprised, like they should be doing this earlier. But they don't know how to approach this. I'm sure they don't. And all they want to do is, these big executives, they just want to keep the ball rolling. They do. They're pushing and pushing and pushing, and you got people writing these fluff stories about just in the economy news, right? Like saying like now's the greatest time to buy, and based on our statistics, the economy's going to bounce back in April or fucking May, and da 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 da. It's like, oh my fuck, you guys are just really like totally blind, and that's natural considering the amount of misinformation on this, because people are taking the actual data numbers, that we're looking at, the actual figures for just as that's all we have. There's no more. You know what I mean? But there's actually an extraordinarily large amount more that we're not catching, unfortunately. So by the time that we do catch this, it's going to be way out of control, and that's what's happening in Washington State. It's going to happen in Toronto. It's going to happen in Vancouver. For the West Coast, it's going to be in San Francisco, California, all those places, in the nursing home. It's just a mess. And if they don't put a cap on it now, it's going to be too goddamn late. They're trying to pick up the little pieces, and they're trying to micromanage all the little tiny fucking things to keep the economy going. Well, that's got to stop. This has got to go into damage control mode. We got to shift gears now, and that's just the facts. That's what we have to do. There's no more individualism here. This has got to be a global effort. If we're going to beat it, and if we don't, we won't beat it. It's going to be whoever can get to the hills and to a secluded location till this burns off. Maybe because the fact that it's highly irregular in its genetic makeup, it might burn itself out after the transmission stops. After the last person that's infected dies, let's say, it'll stop, kind of thing. But until then, it's not going to stop. Unless we do something to stop it. Because business as usual is not going to stop this. It's actually favoring it. in a large way, beyond, I think, beyond the scope that most politicians or people are kind of willing to admit, or at least entertain the thought. Because right now it's more of a political and, economical crisis, of course, but it's in the wrong. We're focusing in the wrong areas. We really do have to bring this to the next level. We got to stop micromanaging at all our little fucking, and we just got to raise up and somehow get on board. We got the technology to do it. We got the technology to communicate globally. We got to open up the channels, and we got to get people talking, and we got to get this fucking stopped, and we got to get everybody on board. We have the platforms to do it. Twitter, social media, everybody can get on board with this. We can make it some kind of challenge, like the fucking coronavirus challenge or something. I don't know. Like, we gotta bring it to that level. It does have to be there. Like, Jesus Christ, people do Tide Pod challenges for fuck's sakes, like, and get on board with that, and it creates a media frenzy. Like, can we at least do something, like, to create, a togetherness to save humanity, maybe? I think that has to happen, but will it get there? Will it get there? That's the question. And will the powers that be that are involved in this go to that level? Or is that just totally out of the question? Is it just continue to contain it and try to contain it until it just absolutely is just shit everywhere? And then there's absolutely, even if you wanted to try and contain it at that point, it'd actually be futile. It'd be useless. You couldn't do it. You'd have to just, I don't know, find your own little island somewhere, right? Natural resources. That's what you'd have to do. Because if we don't stop it, we're not going to stop it. And that's what it will come to. This thing isn't going to burn itself out anytime soon. No matter what we're looking at, the numbers in China, that's bullshit. For the fact that they can't test, for one, and the other fact that most of their healthcare system staff are dead and infected. They really are, like, they're top levels. How, you can't test for this if your best people are fucking sick and down. Not only that, they don't have the testing kits. Because the rest of the world doesn't have the testing kits. How the hell does China have testing kits? They don't. That's why they changed their testing criteria. And that's why they changed it back, because it just went batshit crazy. Like, it spiked in one day, like 10,000 cases when they changed their criteria to CT scans. You can just take an image, and if the person had an pneumonia and a couple of the other onset symptoms, they could classify you as, confirmed. But then they ran out of the slides. There's discs. There's discs that they need to do the imaging. And that, you can't use the same one for each image. And all these, all the resources are tapped in China, and they have been for a while. And that's just the facts. If the rest of the world can't get the resources, how the hell's China getting the resources? Yes, they might make it there, but their factories are all closed. Everybody's in quarantine. And people don't understand the gravity of the situation. I was shitting my pants when they quarantined the first city of 11 million people. And then 2 days later, they expanded it to another 15 cities. In 2 days. And I thought, what the actual F is going on here? And then it just kept rolling out. The quarantine just kept rolling out. Now it's everywhere. So what are we going to do? That's the question. We can't lie about this anymore. The politicians can't. They're going to fucking man up and just say their excuse or whatever the fuck they're going to do. Because, people need to hear that before people start panicking. Because having no truth is worse than having the truth. Because, we fear what we don't know. And we'd rather know something and still be scared than rather not know something and be scared. Because that's going to be even worse. I think. But it's only a theory that's going to have to be tested in the field. We can't simulate this right now. We got to just fucking try it. And if it's not going to work, then it's not going to work. But that's where we're at, right? If we don't do something, it's coming for us anyway. So what do we got to lose? Everybody's got to get on board. Everybody's got to, like, I don't know, make it like a fucking 48-hour challenge or some shit. And have everybody get prepared in 48 hours to fucking go into, like, a hibernation mode. But at the same time, it's got to be done at a community level in a way that everybody's not jamming the fucking stores. Right? That's going to be tough. That's going to be tough. But it could be done. If the quarantines were in fact, if the cities went into quarantine and they restricted the movement in the cities and said, okay, everybody go home, and they did it by sections of let's say like a grid section through the city. In this grid, these amount of people are allowed to go out to the stores, and then fucking you got 2 hours, and you got to get back to your house, kind of thing. But just be in reasonable time. But if you let certain amounts of people out at a certain amount of time and allow them to go back, and you could even sanitize while in between people making their pickups at different stores, right? Designate certain stores for high volume, right? Get all the stores, get everybody, all the transport trucks moving and getting them to transfer all the materials to these big stores. All right, so everything's all on tap, ready to fucking go, no fucking around. And you'd have to do it in a strategic method, because if you don't, and it'll just fall to shit. People will just go run to the stores, everything will get overloaded. People at the stores will start panicking because, it's just a panic situation. And just everybody waiting in line, it's just going to be a fucking shit show. Nobody likes waiting in line, especially being stressed out about a fucking virus and waiting maybe beside somebody who's, let's just say, of Asian persuasion. I'm just saying, it's facts, right? It's not a racial thing. Some people will use it like that, but it's more of a self protection thing, right? Of course, it's not the person, it's what they might be carrying, right? And now it's not just that, it's everyone now, possibly, right? It's spread to the point where it's outside of China, and it's now moving through the community and the globe everywhere. So it's people at home that are infected. It's every nationality, right? We can't judge that, but naturally our first thoughts, if we were standing in line with somebody like that, we'd probably leave. I think maybe some people, to be honest. So that's just protection. That's not racial. That's not xenophobic. That's personal fucking protection, right? It is. And to have that awareness is a good thing. And you have the media criticizing it, saying, well, they're causing, well, some people will use it as an avenue to further their fucking racial tendencies or whatever the fuck. That's natural. It's just going to give them fuel for their fire, right? But everybody's affected by this equally. It doesn't fucking matter, right? It doesn't matter if this guy's fucking beaking off his fucking lips. If you go over and start beating up an Asian guy, well, and he's infected, you're probably going to get infected, and you'll just get what's coming to you in the end, right? So, anyways, let's get back on topic. I'm just fucking rambling here, but we gotta get on board, like everybody. I don't know what you gotta do. You gotta get some celebrities involved. You gotta get people on YouTube or whatever, but you gotta get the world's attention in a good way. And we can beat this if we do it the right way. If we don't, we're gonna fail. Right? We can't follow the same footsteps as China, because that's where we're headed actually right now. To be honest, we're following their exact footsteps as to what happened. The media is being very vague about it. It's not being talked to. It's just being blown over for the most part. And that's what happened in China, except to more of an extreme level, right? But it's still not being openly discussed on a platform that it needs to be, and it's not being brought out into the open so that we can address it for what it is. If we don't know what we're fighting, how can we fight it? They gotta be transparent with this as best as they can. Don't put it into you can still be transparent, but at the same time, you don't have to make people freak out. it's gonna be hard, I know. Yeah, it will be. But at the same time, I think everybody's aware of the situation, and people just want to be safe. Right? People just want to be safe and know that they're safe. Okay, so if you can give that sense of fucking safety by implementing the measures that need to be in place, people will be on board with that. Right? People are going to understand the gravity of the situation for the most part. I really believe that. You're going to have a percentage, of course, that are just going to go off the fucking handles. And that's to be expected. That, you can't avoid that. We'll just have to deal with that as it happens. Whatever. But for the most part, I think people will be on board. But if they still, that's just me talking about this shit. If they don't do this, it's not gonna fucking stop. And there's so many ways that we could go about doing this. But there's only gonna be very few that are gonna be at least the most effective way, without causing complete shit show. Alright, so it's gotta be a very delicate thing, but you gotta be honest, and that's the main thing. The world, they need to be honest. The fucking scientists, all these people, because we all see what's happening, right? And you got all these people reassuring people, and even in New York and places where they're having outbreaks, as California, they're still saying it's low. There's still, we got community transmission at these levels. We got nursing homes outbroken. We got staff members and firemen and police officers on lockdown and infected, showing symptoms. But the risk is low? What the actual F, man? These people need to shake the shit out of their fucking, really. It's gotta stop. And if it doesn't, it's not gonna stop, unfortunately. Because if no matter what we keep doing, it's only, the time's just ticking away. And as time ticks away, this virus is only keeping on moving, spreading, with no action being taken. It's actually, the perfect environment for it in these big cities. People are being more conscious and aware, but we don't know how actually infectious this is. You could be walking down the street, in say a New York setting, any big street, busy area, where it's packed kind of cord, you're walking down the street, you got people shoulder to shoulder. If there's, a couple of people infected in that crowd, they could be infecting dozens of people. It's just natural. It would be logical, but how infectious is it? That's the real question, and they don't seem to really know that answer. A lot of different values came out for this reproductive number when things started coming out. The first one that came out was 3.8. And a 3.8 is basically terrible. Anything over 2 is bad, but we got anywhere between a 2.3 and a 4.9 is what they're officially saying, which is either bad or completely fucking bad. It's either on a scale for, there's no in between really, and it is based upon the interaction people have with each other. If people who aren't infected are interacting, that's no problem, but we don't know who's infected and who isn't, because of the asymptomatic transmission. And they keep downplaying it, saying, well, that's not the main method of transmission, and that's not what our data shows. Fuck what your data shows. This is a this is a virus that ripped across the globe in less than 7 weeks. 7 weeks. That we've been tracking kind of, but it's ripped across the globe in that time, and we know how viciously infectious it is because of the cruise ship. Look at the cruise ship. God damn it, everybody was infected on there. That's why they shut it down. The tests just kept coming back positive, and they were like, well, we can't waste these tests on people The Japan government was like, we can't waste these tests on people who we know are fucking positive on this ship when we got, our statesmen people or, other people who are vital that we need to be testing and using these tests on. Come get your fucking people. And that's why the US did an about face on that. They were all about the quarantine, and everybody, they had all these people speaking on CNN saying, well, that's the best thing, and yeah, well, given the circumstances, it's unfortunate, but that was the directive, right? Everybody was kind of on board with it, and then all of a sudden it was just no, about face and fucking let's get them out of there as quick as possible, and that's why, because everybody was infected. That's why, and they couldn't afford to, the Japan government couldn't keep up to this on their own level, let alone having to deal with a cruise ship and supplying people and staff and resources to this cruise ship. Come get your people and deal with your people on your own, is what they said. And the people that came to get their people, they could. And they did. So, we know how viral this is. It's absolutely ridiculous. So it has to be addressed, right? What they're saying and what we're seeing are two different things. And if you don't, you probably wouldn't see it if you weren't like following it as close as like most people like me are. You wouldn't see it because all the newscasts, all the shit that I've seen, it just bleeds incompetence and just lack of action, and the science was there from day one. It really was, but everybody was like, well, look at these numbers. Look at these numbers. I remember when the numbers were like 127. And I was when I first started following this, like when I found this chart, I was literally glued to it. And like 2 or 3 people would pop up and I'd be like, oh, I thought that was a big deal at that time. God damn. How the times have changed. We're lucky if we see any less than 2 people die a day now. Let alone just be infected. We got an issue that needs to be solved in the utmost way, very fast. And who's going to do it? Who's going to get the world involved? Who's going to get the world on board? Or most of them. We won't get the whole planet on board with this. But if the people made a stand, the people people do come together, god damn it, they do. But now would they shut down their social media sites if everybody started doing that shit? You know what I mean? Oh my god, we don't know where this is gonna go, right? It's uncharted territory. And let's just hope the powers that be come to their goddamn senses really fucking soon. Because you know what? It's real. And people need to know it's real. Because a lot of people are still either on the fence or have no idea at all. Or, people like me on the other hand. Stressing to people how serious this is. And I've been called like, oh my god, like not terrible things, but definitely nobody believes me. Most for when I first started doing these little things, these YouTube videos. Like I literally went out and bought a mic. I'm not a streamer, but I felt like I had to like do this to get information to people because I knew that there was something going on at a different level that people just weren't getting. And I felt that my tinfoil hat was at times pretty goddamn tight. And it was hard to decipher what was real and what's not. But for the most part, now that I've been down this road, or looking back in hindsight, it's like, god damn it. And considering what I know now and what was known before, it all adds up, and it adds up in a bad way. That it's not good. It's probably worse than I'm even thinking. But I'm really trying to be cautiously, let's say, optimistic. I'm a in a pessimistic type of way. And it's not that I'm a pessimist, you know, it's not that I'm trying to like be the doomsday thing on this. But it's not fake news, and it's not fear mongering if it's facts. And if you don't understand these numbers by now, like what we're catching and what we like these are countries. It's fucking everywhere. You see these countries that only got like one case or something. Well, maybe they do. Maybe it's very possible that they might only have one. But these are very poor countries. And their testing capabilities, and Chile just reported their case yesterday. Or just a little while ago. Their first one. So we don't know the testing capabilities, you know, because it's already stretched to the limits in most places. And unfortunately, probably the UK, Russia, China, Canada, US, Australia, you know, would probably be the ones that would have the majority of the tests. You know, maybe France. South Korea's testing a shit ton of people. They are. It's actually they're the highest testing country in the world right now. Obviously, well, their numbers, but we, you know, again, all these numbers are just with a grain of salt, right? We're definitely not catching all the cases that are out there, and it's very important that people realize and come to sense for once and call this what it is, so that people can get on board with it. You know, you can't keep going the way it's going, or it's only going to get worse, right? And the first responders, our number one priority is ensuring safety of our first responders. Yeah, and here they are, like, showing up to like scenes. I don't know where the hell it is, but yeah, it's they're way under prepared in my opinion for at least personal protective equipment from the nursing home. Like these people here, like, you know what I mean? These are first responders. They got masks and they got just like glasses on, safety glasses. They're not sealed, you know. They're going into a nursing home where potentially this thing actually probably is absolutely everywhere. We don't know how infectious this is, but they just walked into this environment wearing the most minimal protection possible. Craziness. Crazy. But anyway, we'll see, right? Will they wait until it's too late, or will they do something? That's the question. And will you do something? I did. You know what I mean? It's happening. You know, the transmission's not going to stop unless things stop. And unfortunately, that's where we're at. But they're not going to call it that, I don't think. I think they'll just keep letting it roll over until it's just absolutely a goddamn mess, like it happened in China. And that's exactly what happened in China. And then when they wanted to do something about it, well, fuck, they couldn't. It was already out of control. Right? So, let's hope that they wake up, and let's hope that, you know, some people at least, you know, take it into your own measures. You know, don't wait for these clowns to tell you to do something, because they're more focused on money right now. So that's funny. The U.S. dropped 2.8%, but everywhere else in the world is almost posting gains right now, because most of the investors are taking advantage of these super good deals that are happening, because all the rates are going down. You know, they dropped so much that people actually can't even wait any longer, and they're like, oh my god, we gotta like snatch up as many shares as this as we can, and that's what we're seeing here. We're seeing people buying really good deals, but unfortunately, it's only a bubble. It's, you know, you got them throwing all their money at it, and they're predicting that it's going to roll over in April. We'll see about that. We will see about that. So, anyways, all you guys watching, I appreciate it. I think this is the most people I ever had viewing. 52 views. Wow, that is the most. I appreciate it 100%. Share the word, right? Get people on board with this. You know, let's all do our part, right? Because if they're not going to do it for us, we're going to have to do it for ourselves. Oh no, you know, we are the fucking people, right? We are the ones that really matter. So, stay safe, stay vigilant, and take care of yourselves. I will see you very soon. Always keeping you updated as best as I can. Take care. Peace.